A nurse who used to work at a Ridgeland retirement community tells us she got COVID-19 from a woman who lives there. The retirement home says, quote, "That is not true." Now, in a 12 News investigative story, Jade Balexis sorts out what happened.
Administrators with the Orchard, a retirement community, told me over the phone a woman at the home had a stroke and was rushed to the hospital. The Orchard said the hospital then sent the woman to a nursing home in Pearl, which had an outbreak of COVID-19. The woman then had a fall that put her back into the hospital, where she tested positive for COVID-19. The woman stayed in the hospital another 10 days before she was able to head back to the retirement home.
The Orchard is her home, and we brought her right back in. And look, in order to be certain and safe and comfortable, because let me say this, our priority here at the Orchard is making sure our residents and our staff are safe.
But LaTanya Perry disagrees. She worked part-time at the Orchard as a registered nurse. She says no one ever officially told her that someone living at the Orchard had COVID-19. She says she just happened to find out through a random conversation at the nursing station.
And she was telling me about a CNA that didn't want to go into the resident's room. And I said we had got a new admit that day too. So that made it have two people in the room. So I said she went in the room because she fed the new resident. And she said, well, she did it with an attitude because she doesn't want to be in there because bed B has tested positive for COVID. And I said, okay, so when were you going to tell me?
Perry ended up testing positive for COVID-19. She claims she contracted the virus from the resident in December.
And that's how I put it together that I got it from the nursing home, because I had worked with her now on the 17th, 3 days. And then I was sick. I had went to the doctor on the 17th. I wasn't feeling well, and I got treated for sinus stuff, and it wasn't working. I only got sicker.
Perry says she wound up in the emergency room on December 22nd. And then 3 of her family members also got sick with COVID, her husband and 2 children.
I know it started from her because, I mean, we don't go anywhere. We don't do anything. We have to go to the grocery store. We wear masks and this, and you try to stay away from people. You shop and you try to stay 6 feet away. And then we've been fine, but I knew if I got it, I was going to be sick because I already be sick with my sinuses, and I have bronchitis.
The Orchard says it takes all precautions and traced the infection, saying the patient did not pass the virus. The Orchard adds it took an additional step of quarantining the woman after she got back from the hospital.
We do everything that the CDC expects for us to do. Not only is everybody in a mask, we do temperatures, we have them wear gloves, we socially distance everybody. So we've done absolutely everything we possibly can.
As for LaTanya Perry, she says she is no longer working at the retirement community. She didn't get fired or quit. She says she just wasn't added to the schedule for February. Here's some information we got from the Mississippi Department of Health. There is no way to determine from an investigation that a staff member was infected as a result of exposure to an infected resident. All staff must interact with residents with the appropriate level of PPE regardless of known infection. There is no requirement that new admissions to a facility receive a negative test. The recommendation is that they should quarantine in a separate room and be managed with appropriate infection control on the chance they may be infected. For 12 News Investigates, I'm Jade Balexis.